having a feedback loop. Now we're going to talk about some clever ways but legit ways to solve MCQs. But these are not tricks, these are exam patterns. If you use this without understanding, they will fail you. They will like not be so helpful. So we're going to start with stem handling heuristics. What are these? So the anchor method. The anchor method is, when the examiner is writing a question, what they'll be like, okay, if I can't make the question very difficult, what I can make is I can make the question very long. So you need to understand the long question is not necessarily always the most complex question. Whenever you have a long question, you need to, or a question which is like more than a couple of lines, always read the last sentence of the question first. Always read the last sentence of the question first. Identify the task. What is the examiner asking me? And then you read the stem selectively. Most of what you will read on the stem is noise. You have to eliminate the noise and you have to get to the most important juicy part. And the last line decides the task. So imagine you're going to construct a building. You will not go and start talking about what kind of tiles you want in the bathroom. You'll first talk about the foundations. You'll talk about how much you're going to get paid. So you basically what I'm trying to say is you need to identify the task, and you need to know you need to selectively read the stem. You don't have to read the stem as if your life depends on it. You need to read the stem as in what is important here and what is not. But always start with reading the stem. Always start with reading the last line. Now, single anchor principle. Most of the MCQs that you will solve, hinge on one anchor, as we talked earlier. That is, there is just going to be like this one thing, because the examiners understand that you will only have 1 minute to solve this question. You will only have like a minute to solve the question. So what will they do? They'll provide you this one anchor which will help you go through it. But your job is to recognize that anchor. Maybe it could be one symptom which is found nowhere else, just there in that one condition. Maybe there is this one lab finding which is the most optimum answer for the condition given among all the options given. Maybe there is one image that you need to remember. Maybe there's a huge stem given, huge description, and you have an image given. Just based on the image, maybe you could answer the question. And one constraint. What is the one thing that you need to for example, look into, is it maybe the patient is pregnant, maybe it's an emergency case, maybe one of the very popular questions is asthmatic people cannot take beta blockers. That is something they use a lot. So you need to, for example, check for predisposing factors. Just one constraint will give you your best answer. And once you find this one anchor, you stop overthinking. Time course overrides everything. Time course is the king. You need to understand if the condition is acute versus chronic. Did it happen suddenly versus gradual? If the presentation is early or late. If the time course doesn't fit, the option is wrong. Now we'll get to option level heuristics. In option level heuristics, we're going to talk about numerical answers. The thing is, examiners like to play with numbers, because you're not definitely going to benefit from knowing all the numbers out there. You can Google things, but they need to have some type of trap questions. So here, what we can generally assume is extreme answers are rarely correct. We are going to assume that extreme answers are rarely correct, and and the middle range answers are safer, and we are going to remove outliers. Why are we going to do this? Because the way that human minds work is that you cannot just give the correct answer, because all of them are going to be numbers. You cannot give the correct answer without stuffing it between wrong answers, and you have to make sure that the wrong answers are more believable. So they will put an extreme, but extremes are rarely correct. And then middle range answers are safer, and we have to remove the outliers. Examiner avoid absurd values unless testing toxicity or emergency cases. Grammatical congruence, language consistency. This is a beautiful part of English language that and other languages as well. For example, if the option ends with if the task ends with what is an example of the following, and maybe the sentence ends with an a or an an. You could think about, okay, the option is most likely going to start with a vowel. These days they're getting a bit clever with it. They're not so bothered with it, right? They're making sure they don't make the same mistakes, but careless grammar often exposes wrong options. Maybe it could be about singular or plural tense, or there could be tense mismatch, right? So you need to look out for the careless grammar problems that the examiner might have left. Length and qualifier rule. So there is this idea that in science you need to have precision. So longer option bias says that to make something more true, because like science has different angles, right? Any fact that you can read can have multiple different angles. You need to make it more specific. So to make an option more specific, to make it more correct so that more people agree with it, you have to add qualifiers to it, and you have to add conditional language to it. That is, in certain cases this is true, and you have to have nuanced wording, because if if some people disagree with that answer, then the MCQ is going to be faulty, and examiners cannot afford to do that. So what they will do, they will make the correct option really long. So truth needs precision, lies can be short. You need to understand that truth will need precision. So lies, wrong options might be shorter, and correct options might be longer. Absolute word elimination. You have to be aware of absolutes, because in medicine and sciences, there's almost never going to be absolutes. There will always be exceptions, and that is the beauty of science. And that is the one fact, that is the one part where the examiners can try to dupe you. You have to make sure that you never just go blindly around absolutes. You have to be a little bit more careful. If an option says absolute in some way or the other, you need to basically think twice about it. And absolutes are going to be wrong a lot of times. Now we'll talk about paired distractors. For example, in a question, if out of the four in a question's options, out of the four options, if one option, like two options talk about hyper and the other option is hypo, and one option talks about increase versus, and the other option is decrease, and one option is, for example, agonist versus and the second option is antagonist, then there is a good chance that one of them is going to be the correct answer. You have to eliminate the others first and then move on to them, because when we have paired distractors, right, it is more likely that one of those is going to be the correct answer. And don't worry, I'll show you some examples at the end. Umbrella versus specific. This is a beautiful thing, because imagine what will you do, for example, if you have a poisoning case. Like, we were having this discussion with the intern group, and one of the students were like, oh, we'll call the doctor. Yeah, that's a beautiful thing. You have a poisoning case, you'll call the doctor. But that is, don't you think, a very umbrella kind of a suggestion? That's not very specific. So we have to match specificity to the question. What is the question asking? If the question asks specific, umbrella answer will be wrong. So there is going to be general option, there is going to be specific option. We need to select the specific option.